Hello, I am Dr. Sang-ho Lee. I have a very sad question. It should be fixed. He is a guy, but his back is curvy like an old woman's. It can be fixed. Please stay hopeful. Let me tell you the question. I am a 69-year-old male. I had surgery in May of last year for spinal stenosis. There is nothing wrong with anything else, but my back is bent. I become like a crooked old woman as my back is bent. 3 screws were inserted. He asked, can I have surgery again? He has to do the surgery again. After spinal surgery, you should have a full and normal life. You should be able to stand upright with your back straight and be able to walk upright for at least 30 minutes. If your back starts to bend after walking for only 5 or 10 minutes, that is not ideal. After walking for 10 minutes, try taking an X-ray. If your back is bent, you need to fix it. Normal people do not bend forward even if they walk for more than 10 minutes. So what's wrong with this patient even after spinal stenosis surgery? There may be 2 main reasons. One is that there is another disease in the area where the surgery was performed. Another disease developed above the area where the screw fixation was done. On top of that, stenosis has developed again. After screwing in, 3 screws are fixed. Something went wrong with the above level. This causes the spine to bend forward. The above level should be fixed. Above all, screws need to be taken out if the patient's back is bent. If the screws are placed well, there is no way the back is bent. It's been a year since he had the surgery. Because he had the surgery in May of last year. These screws are not fit for him. Screws should allow the waist to be straightened. Your back should be upright and straight. He is currently 69 years old, and his life expectancy in the future may be 95 years. He has to live another 20 or 30 years, but he can't live as an old man, walking bent. Screws should be removed and treat the stenosis on it. However, reoperation is very difficult. So how do you make it easy? That is to approach from the other direction in surgery. Changing the philosophy in surgery. It is known that reoperation in the same way is risky. So, since spinal reoperation is risky, many patients have heard the saying, if possible, talk with the surgeon who performed the original surgery to get a reoperation. What if you go to the person who did the surgery? The surgery went well, but we have to wait. The surgery went well. What are you talking about? Usually, those are the answers. So you need to go to a specialized hospital for spinal revision surgery, spinal team that fixes it from a different approach and with a different philosophy. It is difficult to do it alone. Why not be alone? If you want to have a revisional spinal surgery, it requires to have vascular surgery, cardiothoracic surgery, and neurosurgery. The spine team can fix it together, so it can be 100% safe. There should never be any risk. 100% safe reoperation is necessary if you have a surgery in a hospital with a well-organized surgical team for reoperation. The back can be straightened again and you can do sports or daily life with your healthy waist. Men are more likely to live to the age of 95 as expected life expectancy. Women are already 95 years old. Now men's life expectancy is also going up to 85 to 95 years old. Don't give up just because you've had surgery once. If you have a surgery with reoperation surgical team, you are able to recover to a normal back condition. Thank you.